miniComfort is a product that's been around for many years. It is a deprogramming device. It is a tooth protection device. It's a device that's worn just on the lower. It has two little discluding elements, and these elements nestle right underneath the maxillary canines. Why there? Because it's based on cuspid-guided disclusion. The idea is that the canines and the maxilla are the most sensitive teeth in the mouth, and when you contact the discluding elements, a patient is immediately signaled that they should open, that they should relax, and they should deprogram. Now, there aren't any good devices on the market that do that during the day. There are other devices, but patients don't like to wear them because they affect your speech, because they're bulky, they're cumbersome. They're just really not that effective, and patients won't be compliant. With a miniComfort, they will be compliant. They will wear this happily to protect their investment, their natural teeth. We even have patients wearing them that are in dentures, because as you know, dentures will just wear down over the years. So you can wear this, it's held down with suction, either tissue or a flange of a denture. Obviously, mostly it's going to be dentate patients. But it wraps around the tissue, it's held in with suction. After a few days, a patient will hardly even know they have it anymore. As far as the comfort, their speech will adjust to it. They'll love it, and they'll thank you for it, because dentistry is expensive. We use a lot of miniComforts in full arch cases. In fact, if the case is right, then it's our standard for, let's say, a full arch of zirconia, like a final fixed restoration or any material. It is our standard, as long as the situation is right that we can make one for the lower, because it can't be made for the upper. So the miniComfort, as I mentioned, has the discluding elements. That's the deprogramming part of it and the protection part of it. It only goes back to the bicuspid region, does not go to the molars, because if you clench, you don't want your molars to contact. When you clench, you only want to contact on the discluding elements here. So it is made for protecting the investment. It is made for retraining, deprogramming during the day, right? Patients are not going to deprogram at night. All they're going to do is protect at night, a traditional hard guard. But they're not going to have any stimulus that's going to change any behavior. They need to change behavior during the day. And that's where miniComfort comes in. And the staff, you, the doctor, the whole team can train their patient. Every time they think about miniComfort, every time they see it, they should be thinking contact, open, contact, open. It changes behavior. The doctor that invented this many years ago used it as just a way to train, to teach behavior change. He started with himself. He had full mouth reconstructions because of clenching, because of issues that he had. He developed it, then he started using it with his staff, and then his patients. He got a patent, and here we are tens of thousands of cases later, and we have repeat, and patients who are saving their teeth and protecting their investment and deprogramming. So it's a daytime and nighttime, or day and. It's 16 hours a day and no more. Simple records, scan the upper, scan the lower. On the lower, you do want to scan or at least take a PVS impression of the tissue, because the tissue is what holds it in place, right? So you want to go down, close to the vestibule with your impressions. It got patented, about 100,000 of them walking around today. It's a wonderful product, the miniComfort.